Discover the comprehensive guide to understanding hernia, its various types, the causes and symptoms, effective prevention methods, and the available solutions for hernia treatment. This informative resource provides invaluable insights into one of the most common health issues faced by people worldwide. What is hernia, and gain a clear understanding of its definition. A hernia occurs when part of your insides bulges through an opening or weakness in the muscle or tissue that contains it. Now we discuss about the different types of hernias. 1. Inguinal hernias. An inguinal hernia is a bulging of the contents of the abdomen through a weak area in the lower abdominal wall. Inguinal hernias can occur at either of two passages through the lower abdominal wall, one on each side of the groin. These passages are called inguinal canals. 2. Umbilical hernias. An umbilical hernia is a ventral hernia located at or near the umbilicus. In general, umbilical hernias tend to have a narrow neck, which increases the risk of strangulation and incarceration. The majority of umbilical hernias in adults are acquired and may occur either above or below the umbilicus. Three. Incisional hernias. Incisional hernia refers to abdominal wall hernia at the site of a previous surgical incision. It is a type of ventral hernia. Midline incisional hernias are more common than other sites. 4. Hiatal hernias. A hiatal hernia occurs when the upper part of your stomach bulges through your diaphragm into your chest cavity. A hiatal hernia occurs when the upper part of your stomach bulges through the large muscle separating your abdomen and chest, diaphragm. 5. Epigastric hernia. An epigastric hernia is a lump in the midline between your belly button and sternum, breastbone, which can cause pain. Your abdominal cavity contains your intestines and other structures. These are protected by your abdominal wall, which is made up of 4 layers. 6. Femoral hernias. A femoral hernia usually occurs when fatty tissue or a part of your bowel pokes through into your groin at the top of your inner thigh. It pushes through a weak spot in the surrounding muscle wall, abdominal wall, into an area called the femoral canal. 7. Spigelian hernia. Spigelian hernia. A Spigelian hernia is a rare ventral hernia that is defined as herniation of abdominal contents or peritoneum through a defect, namely the Spigelian fascia, which is comprised of the transversus abdominis and the internal oblique aponeuroses. 8. Diaphragmatic hernia. Diaphragmatic hernia is a birth defect where there is a hole in the diaphragm, the large muscle that separates the chest from the abdomen. Organs in the abdomen, such as intestines, stomach, and liver, can move through the hole in the diaphragm and upwards into a baby's chest. 9. Perineal hernia. A perineal hernia occurs when weak pelvic floor muscles allow part of an organ or tissue to push into your abdominal cavity. This type of pelvic floor hernia can be a rare complication of pelvic surgery. It can also develop after an illness or injury. Few reasons for cause of hernia. A job that involves heavy lifting or many hours of standing. A chronic cough or allergies that cause chronic sneezing. Chronic constipation and straining to poop or pee. A history of abdominal or pelvic surgery. Pregnancy, especially repeat pregnancies. The first signs of a hernia is visible bulge in the affected area. Symptoms of hernia surgery emergency. A painful bulge that doesn't reduce in size when you lay down and rest. Worsening pain. Nausea and/or vomiting. Difficulty having a bowel movement. Bloating. Racing heart rate. Fever. If your hernia does not bother you, most likely you can wait to have surgery. Your hernia may get worse, but it may not. Over time, hernias tend to get bigger as the muscle wall of the belly gets weaker and more tissue bulges through. In some cases, small, painless hernias never need repair. So after that you must follow few steps till the time you wait for surgery. Maintain a recommended healthy body weight. Don't lift too much weight. Increase core strength, like lie on your back and place your feet on a wall so that your knees and hips are bent at 90-degree angles. Tighten your abdominal muscles. Raise your head and shoulders off the floor. Control diabetes if you diabetic. Quit smoking if you smoker. Milk with a pinch of turmeric powder. A herbal mixture including fennel, citrus seeds, and hawthorn and lychee seeds. Smaller meals at regular intervals. High water intake. High fiber, high protein, low fat diet, fresh green vegetables, whole wheat ingredients. At last, you must have to consult with your surgeon doctor and ask for proper treatment about this. To live better and happy life ever.